Hello everybody, Dr. John Waterhouse here and welcome to day 2 of this 7-day series. Now I hope you've been fit and healthy and safe since last we chatted. So let me recap. Yesterday we talked about leash walking and we talked social isolation, and I showed you a video that's in our Canine Rehab on demand exercise series that talked about leash walking post-surgical or post-injury, and it had great information for what we're dealing with at the moment. Today we're going to talk about movement, and we're going to talk about movement when it mainly comes to our older pets or our adult pets, because we know 1 in 5 of our pets will develop arthritis in their joint after the age of 1. And so this is important that we're thinking about movement, we're thinking about how to keep that cartilage, because cartilage in the joint is a structure that needs to have compression and expansion to move fluid, to move nutrients and get waste material out. And if we're not moving, then that cartilage is not being compressed and uncompressed. Compressed, it's like a sponge that sucks in and expands, sucks in and expands. And it needs to do this to get nutrients into the cartilage. And if we're not doing this, we're starting to get cartilage breakdown and what's called degenerative joint disease. So this is important for our geriatric patients, because as we're not moving, we're not using those muscles as well, we're not using those tendons, we're not warming things up, they start to cool down. And we know that with any injury, or if we have arthritis ourselves, as you cool down, you don't use it, you lose the muscle or you lose it, and it starts to hurt, it starts to ache, starts to irritate. And that's what's going to happen over the next couple of weeks with our pets. And is as we're quarantined, we're not getting out, we're not moving, we're now starting to see loss of muscle, loss of conditioning, loss of strength, loss of endurance. They're all setting up for the perfect storm that your pet starts to ache and feel pain. And so we need to introduce movement, even if it's not going outside, movement that you can do to all the joints of your pet's body, so that you can stimulate this fluid flow around the cartilage and keeping the joints healthy and safe. So we're going to take each limb through full range of motion. So we're going to be moving every joint in a full range of motion. And so the 2 videos I'm going to play for you at the end also come from the Canine Rehab on Demand exercise series. And we're going to break it down to forelimb and hind limb and how to safely do this exercise. So after this, I'll be playing 2 short videos for you explaining how to safely do passive range of motion. So this exercise is called passive range of motion, and I like to call passive range of motion one of those super exercises, because we're doing multiple joints and multiple muscle systems at the same time. And when we talk about passive range of motion, most people talk about front limb or hind limb. Oh, thanks, Avi, for standing up. So hind limb, we have the joints of the hind limb, and the front limb, we have the joints of the front limb. I'm going to concentrate on the hind limb for this exercise. So we know in the hind limb we have the toes, we have the hock, we have the stifle, and we have the hip joint. And this exercise will allow you to work all those joints at the same time. Why is that important? Because we all know joints are notoriously bad for blood flow. So by moving those joints in flexion and extension in a circular motion, we're bringing blood flow to that area. That helps the synovial fluid bathe the cartilage in that joint, brings nutrients into that joint, but also gets rid of excess waste materials. This is especially important for our surgical dogs or post-surgical dogs, or dogs that have been confined or have splints or some type of apparatus that doesn't allow them full range of motion. We now see muscle atrophy. So we're increasing blood flow. We're actually decreasing pain, because the movement of that releases endorphins by bringing the blood flow, gets rid of the crepitus in the joint and feels good. We're also helping with the synovial fluid and muscle atrophy. So we're slowing muscle atrophy down in these guys because they're not using their muscles by doing the range of motion and we're actually helping those muscle fibers pull apart, getting blood supply into their nutrients, and actually we can help slow down the rate of muscle atrophy. So what we're going to do with this exercise is I want you to imagine that you're riding a bicycle. And so the circular motion, when you're riding the bicycle comes around, comes up, comes down, comes around, your foot touches the ground on the pedal, comes around and goes down. We're going to use that same motion and exercise when they're lying down on the ground. But this is a great demonstration for you just to visualize in your head that bicycle motion of the leg coming up, going around in a nice motion, coming down, touching the ground. And we're going to just do that nice and slowly when she's lying on her side. So let me get her on her side and then we'll continue with this exercise. Now that we have her on her side, it's very important that we lay them down on the non-surgical side. So let's imagine that this dog has had surgery on its knee. This is the surgical leg, this is the non-surgical leg lying down. It's important that we lay them down on the non-surgical side so we have access to the surgical site. Before we start the passive range of motion, I like to just to massage the area. Just touch the area, get them used to touching the area. It helps calm them down, helps with anxiety. If it's a surgical leg, I like to massage back up because this helps with lymph, helps drain the leg. If there's edema or swelling, I massage back up towards the body. If there's a surgical incision here, I stay away from that surgical incision, at least for 2 weeks after surgery and at least 3 to 4 days after the sutures have been removed, just because this is an area of weakness. And if we start going there and doing massage over that area, we have a chance that we can break down the suture material and open that wound. So just nice, soft, it's not a massage, it's more like a touch just to reassure them. So what we're going to do, we have their toes, their hock, their stifle and their hip. And remember I explained it's like a bicycle ride. So we put one hand under the toes and to support the toes. The other hand I like to keep just above the stifle here, between the stifle and the hip as a support. And we bring the leg up, bring it forward, and just a nice bicycle motion as we're coming around. Nice bicycle, and you'll feel an end point. Here you feel like it's a rubber band. And you bring it up, bring it forward, just a nice bicycle motion. And this is working all the joints from the toes to the hock, to the stifle, to the hip. So a nice bicycle motion, just like you were riding a bicycle. We stop, and then we can reverse. And we come down, bring it forward, bring it up, and you can see all the joints are nice, extending, flexing, and then we have a nice motion just going with that. And so we just do it in each direction. If they start to fight or they're not liking it or not cooperating properly, we then stop, just let them down, rub, massage that area. This is not to be an exercise that they fight. It's very important that it's a fun, pain-free exercise because we want them to get used to us touching and manipulating that limb, especially if it's a post-surgical site or they have osteoarthritis of the hip, the stifle, the hock or the toes. This is just a great exercise to help in general all well-being. At any time we're doing this exercise, if you notice any pain or discomfort, please stop this exercise, especially post-surgical, if it's a TPLO or any type of surgery. If they experience any pain, stop straight away and inform your veterinarian or rehabilitation practitioner that you experience pain during this exercise. But this is one of my favourite exercises. I call it a super exercise because it helps all those 4 joints, bringing synovial fluid into those joints, blood supply, especially for dogs that are in crates or don't have access to exercise because they could have neurological issues. This is a great way to keep muscle mass, keep the leg going, but also it helps and it feels great and it relieves pain while you're doing it. So now we have passive range of motion of the front limb. Just like the back limb, this is another super exercise and it's great because we work the toes, the carpus, the elbow and the shoulder joint all at one time. So just like the hind limb, I want you to think about this as a circular bicycle motion. So the hand positions are really important. So we want to put just a nice open hand on the front paw. We don't want to grab it. We just want to have them a nice open hand, just holding it like you would hold a bird. The other hand I like to put just behind the elbow and the between the elbow and the shoulder blade. And this just helps support. So when we're bringing through the motion of the bicycle, we have good support at all times as we're going through the movement. So you can see lovely flexion and extension in all those joints. It's just a nice, slow bicycle motion. At no time should this be hurting. It should just be a nice, easy exercise as we're going around. And it should be pain-free and it should actually be fun. They should really enjoy this. But I like to keep two hands on at all times, one to help support. So the hand, my right hand is supporting under the elbow. Some people do it one-handed. I like to have a two-handed approach to this just because you can feel and support and you feel the end point. So when we stretch forward, it's almost like you're feeling a taut rubber band. And you come back and it comes up and you feel that end point, that rubber band feeling again. And it's just a lovely, slow bicycle motion. Now in tomorrow, day 3, we're going to be talking about strengthening. And so that will be important. But today we're going to talk about passive range of motion and movement. And this is actually a good thing that you need to be doing as well. So you can be doing leg lifts and passive range of motion, full range of motions with your arms, your shoulders. So you should be keeping limber and supple because we as well will suffer when we come out of this 8-week isolation lockdown. So I encourage you, hit the subscribe button below, touch that bell, because that will notify you of the upcoming other parts of this series that will be coming on. So tomorrow will be day 3 in this 7-day series, and we'll be talking about strengthening. So put any comments down below that you might have from yesterday's topic or on today's topic. If you have questions, put them down below. So until tomorrow, be safe, be healthy, and I look forward to seeing you tomorrow. Bye-bye.